Hey class, we are on Chapter 9 of Medical Terminology, Obstetrics and Neonatology. I'm Professor Brian Psycho. Let's get started. Okay, so as usual, we're going to be working through the chapter, starting to move a little bit more quickly after we do our anatomy overview, as a lot of this information is starting to become relatively familiar to us. So when we're talking about obstetrics and neonatology, it's best just to define those terms right off the bat. Obstetrics, in general, we're talking about the pregnant mother and the care of that mother. So you can see the definition there, a branch of medicine dealing with childbirth and the care of the mother before and after the birth. So it's all encompassing. Neonatology is a little bit different in that it's specifically looking at the treatment of the newborn. So jumping straight into our chapter 9, page 345, we're looking at terms relating to the pregnancy. First thing we see here is the gamete, which is the mature germ cell, or essentially it's the sperm or the egg cell. Ovulation, we discussed this in last chapter, chapter 8, about the female reproductive system. And ovulation meaning, again, the expulsion of that mature egg or ovum. Conception or fertilization is the official beginning of pregnancy. That's when that sperm and the egg meet. So that process is called conception or fertilization. That is the point of which embryonic science and medical analysis determines human life to begin. Scientifically speaking, we can say that human life begins at conception. Continuing down the list, we see the zygote, which is the technical name then for that sperm and the egg joining. It is the cell that's formed by that union. And the embryo is the name for the implanted zygote that we will use up until the end of the 8th week of gestation. A quick little anatomy overview here, and some of this is review from the female reproductive system, but looking at page 346, so here we can see the ovary itself and ovulation taking place, the ovum or egg being released by the ovary and being picked up by the fimbriae, which we see here as we discussed last week. And then those are going to move through the fallopian tube. Fertilization takes place there in the fallopian tube as the sperm continue to swim up and then meet that egg. At that point, we have what's called the zygote that we just described, and then that moves down into the placenta, the fundus, and there it becomes implanted, where it will then spend the rest of its gestation growing until birth. A few more terms related directly to pregnancy. Fetus, we mentioned the embryo up until the end of the 8th week. Then we start classifying the baby as a fetus from the 9th week up until birth. Sometimes fetus can be somewhat of a cold name. Most parents obviously are going to call their fetus their baby because that's what it is. It is their baby. It is a human life all the way from conception, like we had previously pointed out. And so sometimes fetus can be a fairly medical or very cold or sterile term that's used. The term gestation basically is just referring to the length or the term of pregnancy as far as the time frame is concerned. Again, we mentioned that from scientific standards, that child, that baby, is a new individual all the way from conception to birth. All of the DNA, all of the stem cells, everything that's necessary for that zygote to become a fully functioning human adult is present all the way from conception. And then implantation, we mentioned that, where that zygote is embedded into the uterine lining. Placenta or afterbirth is what the baby is growing in, that's attached to the uterus. This is what nourishes the child during growth. And the amniotic sac specifically is the membranous bag that surrounds that fetus prior to delivery, which is formed of these three features here: chorion, which is the outermost layer of that fetal membrane, the amnion, which is the innermost, and then the amniotic fluid, which is the fluid inside the amniotic sac. And so we'll be seeing these terms pop up throughout the presentation today. The umbilical cord, most of us are familiar with that. That is the cord that connects the embryo to the mother via the placenta. So that's where the nutrients and blood supply from mom is being transferred into the baby. And the umbilicus is just the navel area or the fetal attachment where the umbilical cord connects. Here we have a nice little diagram of the fetus, and we can see here that the placenta is attached to the uterine wall. We can see the amniotic fluid inside the placenta, and then we have the amnion, which is that inner lining, and then the chorion, the outer lining of that placenta. Note also the umbilical cord that connects the placenta to the baby. Here's an image of the human male fetus at 68 days. And you can see quite a lot of development has taken place at that point already. So just a little over 2 months, or about 9 weeks, 9 to 10 weeks here. Not a whole lot of time, but by the time you know you're pregnant, you've got a well-developed baby growing inside of you already. That's very distinguishable. Combining forms, now we'll skip over to page 347. So that's our anatomy overview and some of the general terminology. Again, that table on page 345 is going to be sort of like your bookmark table for this chapter. This is the one that is containing most of the new information, although a lot of it in this chapter, because we just covered the female reproductive system and there's a lot of overlap, is the same. But everything that we cover now moving forward, we're going to start seeing just how we're going to use those words, as well as adding suffixes and prefixes to them. So we'll move pretty quickly through here. You can see the combining forms on page 347, and we start to see some of these word roots like amnio. So again, talking about the amniotic fluid, choreo about the chorion, embryo for the, obviously embryo, feti for the fetus. Gravido is going to refer to how many pregnancies the mother has had. And then skipping over to the other side of the chart, we see par or para. That's the number of viable births that the mother has had. So there are at times where the mom will become pregnant, but then miscarriage or not give birth to a living child. And so in that case, let's say they had 2 pregnancies and one of them was miscarriage or stillbirthed, then we would have a gravida of 2 and a para of 1, because she was pregnant twice but only gave birth to 1 viable child. So you'll see that in medical terminology, in patients' charts quite a bit when you're dealing with labor delivery and obstetrics. Lacto for lactation, so regarding to the milk that the mother will be producing in order to breastfeed the child. Nate, such as neonate or neonatology, that just refers to the newborn baby. And omphallo, listed right here, omphallo, that just refers to the umbilicus or the navel region. So flip over page to 349. And we'll see this list continued. So cephalo, or like cephalad, so again, towards the head. Esophago, meaning the esophagus. We learned about that in the respiratory system a little bit, and then we'll be learning more about that in the digestive system. Pelve, pelvi, pelvo, of course, around the pelvic and the pelvic bone. Prim, primi, regarding to first, so think of like primary here. This is that word root. Pseud, pseudo, meaning false. Pylor, consider again the pylorus sphincter from the esophagus and stomach region, so again digestive mainly. And then terat or terato, meaning malformation. So again, we'll look at a term called like teratogenesis, meaning that somewhere within Genesis new, the newborn, there's a terat or terato, some kind of malformation of the newborn. Jump to page 350 and we'll see some prefixes. Some of these are kind of new, otherwise we've seen some of these, and some of these we'll use every day just in common language as well. But anti basically means pre or before or prior. Micro, of course, meaning very small. Multi, many. Nulli, meaning none or null for none. And then post, meaning after. Suffixes also on page 350. So amnios, we already mentioned that a couple times now regarding to the amniotic fluid. Ciesis, specifically to a mother's pregnancy. The E or the IS is just there to make the words easier to say. They're not actually have any meaning to them whatsoever. Rhexis, or here we see that double RH component of the word. And that, remember, is very specific to like a blood flow, and we're going to look at different types of these here in just a second. Tosia, meaning to birth or labor. And then UM and US, again, not having any specific meaning. They're just there to make the word easier to say. Some word parts with similar meanings. So nate, such again as neonato, or pero, parto, so like partum. And then puerpero and tosia, we've mentioned all of those meaning having to do with birth or to give labor. Okay, so here's the suffixes, the RRH suffixes that we talked about before. Remember in chapter 4, we talked about rhea, meaning a flow or discharge of blood. And in chapter 5, we talked about regia for a rapid flow of blood. Chapter 6, we mentioned raphe for suturing or repairing. And here in chapter 9, we're seeing this rhexis, which is going to be used for like rupture, as such as a premature rupture of the membrane leading to premature birth. Okay, so your chart on page 352 are obstetric disease and disorder terms that are built from word parts. So again, this is your type 1 category that we learned about way back in chapter 1, but this allows us to break down these words into word parts and understand them from that basis. So again, we look at the amni and the amnio, so we're breaking that down into amnionitis. So we're looking at an inflammation. Remember, we're going from right to left or backwards most of the time when we're looking at these words. So itis, inflammation, amnio, meaning the amniotic fluid, or the amnion, so the chorion, amnion. Remember, the chorion is the outside, the amnion is the inside, and then the amniotic fluid is the fluid that's inside of the placenta. So that amnion, the amniotic layer of the placenta, is what's being inflamed in this case. And then of course we see the chorioamnionitis. That would be an inflammation of both the chorion and the amnion. Choriocarcinoma would be a cancerous condition, oma, carcino, and chorio of the chorion. Dystocia would mean a difficult labor, and hysterexis, okay, remember that rexis term that we just looked at, meaning a rupture, and hystero, meaning the uterus, so a rupture of the uterus. And that rupture of the uterus needs to take place in order for the baby to be delivered. Problem that we often see, though, is a premature rupture of that membrane, and thus a premature rupture of the uterus. And that causes some pretty significant medical problems, or at least it can if it's not handled carefully. Oligohydramnios and polyhydramnios, we've seen this again, amnios, and then the hydro, so the amniotic fluid, and then hydro meaning the fluid aspect of it, water, and aligo or oligo and poly. So oligo meaning scant or little, and poly meaning much or many. So in oligohydramnios, then we don't have very much amniotic fluid, or it's scant, whereas in polyhydramnios, we have a lot of amniotic fluid. Some terms that are not built from word parts. Here we see abruptia placentae. So again, here we're rupturing or abrupting the placenta. So that's that premature separation that I was speaking about on the previous slide. Eclampsia is a complication known to have some blood pressure and convulsive issues that takes place with the mother. And so there's eclampsia and then preeclampsia, which we'll see on the next page. And then ectopic pregnancy, we'll also see a diagram of what that looks like. So I'm going to hold on until we get to that. And then one other term that just bears mentioning in the OB and neonate section is abortion. Now, anytime we talk about abortion in our culture or society, it's always a heated topic or debate, because you have many people on both sides of whether we should be allowing legal abortions or not. I am going to speak from a scientific perspective here really quickly, and that you can see these two textbooks that are listed here, the Developing Human 11th edition from 2019, as well as Before We Are Born 10th edition from 2019. Both are major embryonic medical science textbooks. The science is clear, as has been already mentioned, that according to scientific classification and genetic testing, once that sperm and the egg join together to make that zygote, everything is available to produce a fully functioning human being. And thus, the scientific position is that life, human life, begins at conception. Regardless of how we feel or what side of the moral or ethical aspect, and I'll talk about that in a second, of abortion that we land on, we need to be honest to the science that is out there and accept that human life actually does begin at conception. Now, from the moral perspective, and I want to make the distinction between moral and ethical, morality is typically that internal moral compass that you have of right and wrong, And ethical would be an external or like a legislative or legal boundary of what's right and wrong. So for example, you might think that abortion is okay morally, you don't have anything against it, but in some countries there is laws against abortion. Therefore, even though it's morally okay for you, it would not be ethically okay for you as a healthcare provider to participate in that illegal procedure. Now, in America right now, abortion is legal and legal to lots of different extents, and there's lots of variations in that, so I'm not going to go to all of those. What stage of gestation or up to birth or even after birth or pain capable, all of those things have been thrown around recently, and I'm not going to go into those details. But in America, there's ethically the legal right to abortion. Now, whether or not you morally agree with that is a different situation. I'll leave this topic simply by saying that we need to follow the evidence, right? In all that we do, whether it's evidence for the existence of God at the beginning of the universe or when life begins, we should be looking at what evidence is there, and then we need to be open enough to follow the evidence. Nothing is more frustrating than to have certain sides of the aisle talking about in one breath how we've got to follow evidence and we have to follow science, and science is your Bible essentially, and you go by all of this in order to support their cause. But then on the very next issue, when science clearly states something that does not agree with them personally or morally, then they throw science out the window and they don't even listen to it and just say, well, I have my rights, and I can, the right to my body, and I can do whatever I want because this is the way I feel inside. We got to be very careful to separate our decision making from feelings to evidence. And so try to be very open-minded with these types of topics. Be loving to the people that we're having conversations with about these topics. But also we can't just let people continue to use bad science or bad thinking in order to make decisions for our nation and for culture in general regarding the sanctity of human life. We have really good evidence to demonstrate that life begins at conception. Therefore, whether you agree with abortion or not, what we're doing is we're taking a human life and we're killing that human life. So what side morally you fall on that, that's something that you got to deal with. But scientifically, there is no room to say that we are not killing a baby by performing abortions. We certainly are. Now, if you think that's morally wrong, so be it. If you think that that's morally okay, again, so be it. That's something that, one, is going to have to be reckoned through the laws of the culture you live, and two, that's going to be reckoned at the end of time on Judgment Day. So here's that diagram of the abruptia placentae, and what we'll see here is the placenta here is attached to the uterus. This middle diagram showing us start to be a abruption or detaching of the placenta from the uterus. And then finally here in this last picture on the right, we see a full rupture of the placenta away from the uterus. And when this happens prematurely before birth, this is when we start to put the baby and the mother at risk during labor. Placenta previa is just the lower than usual implantation of the placenta on the uterine wall. So here you can see on this left photo how much lower that placenta is implanted on the wall, rather than seeing the placenta attach up at the top or on the sides of the uterine wall like would be normal. In ectopic pregnancy is when the zygote actually implants within the fallopian tube itself. So rather than traversing down into the uterus, the zygote itself just stays in the fallopian tube and starts to develop inside the fallopian tube. Okay, looking over at page 356, we see some of the neonatal terms that are of disease and disorder that are built from word parts. So again, sticking with type 1 here, microcephalus, we remember that the ending us really doesn't mean anything, it just makes it easier to say, but cephal, meaning cephalad or towards the head, and micro meaning small. Here we see that we have a small head. Omphalitis, again, itis, meaning inflammation, and omphal, referring to the umbilical cord. Omphalocele, where the seal is meaning like a herniation, and then follow again the umbilical cord. And I'm not going to continue to just go through every single word here that's in the text, but remember tracheoesophageal fistula, we mentioned that in the respiratory system, and this is also a common birth defect that sometimes we see that communication between the trachea and the esophagus. Some neonatal disease and disorder terms that are not built from word parts. In the table on page 358, we can see like cleft lips and palates, and if you look at the images that are on that page, down at the bottom, figure 9.7, you can see what that cleft palate looks like, as well as the cleft lip. Down syndrome, a pretty common genetic disease caused by some chromosomal abnormalities. Some of the other ones that are common that we'll see: fetal alcohol syndrome, if the mother was drinking alcohol during the pregnancy. Gastroschisis, I'll show you a picture of this in just a minute. Respiratory distress syndrome after the baby's born. If the neonate is having a hard time breathing, we call that RDS, or respiratory distress syndrome. And spina bifida, I'll also show you a picture of. Esophageal atresia. Here you can see where the atresia took place in the esophagus. So you can see there that there's a congenital absence of part of the esophagus. So that communication between the esophagus and the rest of this lower esophagus down to the stomach simply is missing, and so food cannot pass through, and that would need to be surgically repaired. Here's a picture of a baby with gastroschisis. With gastroschisis, the intestines have popped out through a fissure in the abdominal cavity. Essentially, there's an opening or a fissure in the abdomen, and the intestines form and develop outside of the baby's body. So they're fully functioning, everything works as normal, it's just that they're outside of the body instead of inside the body. So you can see in this picture, those intestines are all outside of the body, and they have those wrapped up now that the baby's out of the placenta, basically with a saran wrap type of material that's going to keep that clean and then also keep them bound together until that can be surgically replaced back into the baby's body. This happens fairly often, probably more often than you would think, and it typically is not something that causes major life issues. Spina bifida. Spina bifida is a condition where you can see the spinal cord inside the spinal column, and there's a herniation outside of the lower back that causes part of the spinal cord to herniate outside of the body. And you can see that down here in this image. You can see a little bit of the spinal cord popping out in that herniation of the lower back. And again, that is going to be surgically repaired. Here you can see the child who had that surgery done, spinal cord was put back into place, and then the patient was closed up. Bottom of page 361, you'll see some obstetric surgical terms that are built from word parts. So amniotomy and episiotomy. Remember that otomy means to make an incision, and so an incision into amnio, or the amniotic sac, and then episio, referring to the vulva. So an episiotomy would be a surgical incision made in the vulva, usually made in order to prevent tearing or further tissue damage during delivery. Flip the page over to 362 and we see some more obstetric diagnostic terms that are built from word parts. So like a diagnostic imaging is in here with like a pelvic sonography, and then amniocentesis, amnioscope, and amnioscopy. Here's the ultrasound, the pelvic ultrasound that we were discussing, and here's the amniocentesis, which uses that amnioscope or amnioscopy in order to help guide this needle down into the amniotic sac in order to pull out some of the amniotic fluid. Now, we would do this in order to evaluate the baby's health and the health of the amniotic environment. We can pull proteins and enzymes out of that, as well as white blood cells, red blood cells, and make diagnostic determinations based off of the amniotic fluid that is pulled. Complementary terms to obstetrics and neonatology. Here we see a really long couple of lists here starting on page 364. So I'm not going to go through these, but just make note that we've seen a lot of these already: fetal, gravida, embry, antepartum, beforepartum, amnio, lact. So really familiar words that we've already looked at, either prefixes, suffixes, or word roots, going all the way back to that bookmark chart that we looked at the beginning of this chapter. And then we're just putting them together here in order to make our complementary term. Here's another list of the same terms just being continued. I will point out the teratogenic that we mentioned at the beginning of this lecture. Some complementary terms that are not built from word parts, you can see this list over on page 370. Again, here I'm not going to go through all of these. I'll just point out a couple of specific terms such as APGAR, which is a neonatal assessment tool. It's actually an acronym. So when a baby is born, we're going to take them through an APGAR scale and give them a score, which is going to tell us in general, overall, the health of that baby. And then we come to the end of the chapter and we see our abbreviations. Some of these which are fairly familiar, such as C-section and OB for obstetrics, and others that may not be. And you can read about those in your chapter. So again, I'm not going to go through each one of these just for the sake of time. And that's where we are going to close Obstetrics and Neonatology for Chapter 9 of Medical Terminology. Thanks for joining me today for this presentation, and if I don't see you in class, I'll see you online.